there, my name is Lydia and today we are going to look at healthcare sectors. And here we are going to see healthcare as in the big industry that covers different health sectors. Those sectors include farmers, hospitals, we have medicine manufacturing industries, we have clinics, and many more. All these different sectors have the purpose of protecting and saving the life of people. So all careers do not require one to be a doctor or a nurse. There are other industries like a person who work indirectly in health deals and other work do not work directly in health industries. Like for example, in a hospital we have doctors, we have nurses, but still we have people who work in the administration like the receptionist and many more. So here I'm going to provide at least 3 different examples of non-clinical healthcare jobs, and I'll describe the education and skills necessary to work in at least 3 non-clinical jobs. We have medical assistants. They assist doctors in their jobs. Excuse me. They have associate deep arts. They can have associate arts, that's AA, or they can have a bachelor's degree in health information management. They have skills such as communication and recording skills. They are the one who keep records and give appointments to the patients. We have also medical transcriptionists. These ones, they are non-clinical healthcare jobs. They have associate degree in medical transcriptionist, and they have medical terminology, language, and writing skills. We have also medical secretaries. They can acquire skills in high school or other colleges. They manage the flow of information in office software skills, and are very necessary to their jobs. So I'll also explain what allied health professions are and provide examples and brief description of at least 6 allied health professionals. So the first thing is allied health professionals, which means the segment of healthcare field, and this help in delivering services involving the identification, evaluation, and prevention of diseases and disorders, dietary, nutrition services, and health system management, and many more. I'll start by dental hygiene. This is an allied health profession that deals with cleaning teeth and also providing related dental service and care. For example, if you have your teeth with problems, the dental hygiene, they help you to clean up your teeth and help you how you can keep or maintain them in the right way. So you have dietists. This is an allied health profession that deals with and food and its effect to their life. They can help you when you want to reduce the size or to go fat, for example, by directing you with the proper kind of food that you have to eat in order to maintain the figure you want to have. And another thing, you can even have some diseases, as in diseases caused by the kind of food you eat, but once you go to a dietist, he will help you to know the kind of food that you have to eat. There's also physical therapy. This is the treatment of a disease or an injury of the muscle or joint by using massage, exercise, heat, and many more. So respiratory therapy. This is another allied health profession that care more about medical treatment of respiratory diseases, especially those of lungs disease and other respiratory care. So radiography. This is an allied health profession that deals with taking photography of the inside of a person's body by using X-ray. For example, if you have a problem with your lungs, you can go to the X-ray, they take some examinations, they see inside of you what happened to your body. So these are the ones that do that for us. We have athletic training. This is an allied health profession that deals with treating people by using sport medicine. So after that, I'm going to describe the LPN, RN, and nurse practitioner level of nursing, and at least associated education requirements and typical job responsibility of each. I'll start with registered nursing. These are likely to work in hospitals, nursing homes, medical offices, schools, court prisons, tourist sports events, and many more. Their job responsibility include performing physical exams and health histories, provide health promotion and counseling services. When we talk about counseling services, these are people who might be depressed. You find that they might even want to commit suicide, but once they go for counseling, they come back to their normal ways. We have administer medications, wound care and other interventions, interpret patients' information, and make critical decisions about needed etc. For education backgrounds, all RNs have basic nursing education and licensing. Okay, so as we proceed, we're going to see the nurse practitioner levels of nursing. Mainly those are advanced practitioner registered nursing, that is APRN. This is a term used to define big sets of nurses who have at least master's education and non-practical requirements beyond basic nursing and licensing that is required of all RNs. Some of the subset under this big set include the following. Let's start with nurse practitioner, that is NP. Those are nurses who work in clinics, hospitals, private offices, and many more. They provide a lot of basic and prevention health services, diagnose and treat common minor illness and injuries. So let's talk about now the certified nurse midwife, that is CNM. Those are the nurses who more specialize in well woman, and that is gynecological, and they can be perform hospital birth centers. So these help with pregnant women. Have also clinical nurse specialists. Those categories of nurse work on a big range of physical and mental health problems. They can be found in hospitals, clinic, private offices, and other related communal basic places. So we also have certified registered nursing. These are anesthetists, that is CRNA. Those are advanced nurses, and they are the one who like more to give anesthetics to the patients. They can be found in clinics and hospitals. For example, if they are going to to treat a wound, they have to inject you with this anesthetist, and then after that they can treat you when you're not feeling that pain. Then we have LPN. Those are the nurses who provide the basic nursing care, such as checking blood pressure of the patient, provide basic comfort of the patient, record the patient's status, keep recording patient's health, etc. So in addition, LPN work under the control and direction of RN nurses. Those kind of nurses can be found in hospitals, physical offices, and private homes. About their education and backgrounds, LPN should complete an approved education program. Those programs give a diploma, and they can take about 1 year to complete them. These are like training, so you go there into their seminars. They provide some information or skills that are needed, and those programs can be found in technical skills, colleges, hospitals, or high schools. So thank you for being with me. That's all.